You're all about natural results.
Absolutely. I'm very passionate about making people feel really confident in their skin. We had over 80 people attend our launch.
80 people.
80 people.
I think that might be the record. I think you.
Tighter, firmer, smoother, brighter skin, and Neogen can deliver all of those.
Yeah, I know you're rocking it right now.
Yeah, we are rocking it, absolutely.
Yeah. Coffee-filled workdays or wine-filled evenings. Woo. Welcome to the Neogen podcast, where we dive into the world of aesthetics with leaders in the aesthetic industry to learn about how Neogen and their clinic operates. I'm Simon Jones. I'm president of the Energist in the UK, and today I am joined by Dr. Hayley Elsmore, who is the medical director and founder of the Courtyard Aesthetic Clinic on the Isle of Wight. Dr. Hayley, how are you? Welcome.
Thank you so much, Simon. It's really good to be here.
Great. It's really good to have you. This is an exciting thing for me to do, and I hope you have a great experience, and I hope we have a good conversation.
Thanks, Simon. Sure we will. Got plenty to chat about.
I'm sure, and I've got plenty of questions to ask. So what we're going to do is we're going to just have an informal conversation. I'm going to ask some questions, and we'll just go through that together, yeah?
Sure.
All right. So in terms of thinking about your transition from medicine to aesthetics, you've had an incredibly diverse medical career, from studying medicine at Newcastle to working as a GP for 16 years on the Isle of Wight. What motivated you to transition into aesthetics, and how was your medical training helpful to help you achieve that transition?
Yeah. I think mine's a fairly unusual story. I was working as a GP, as you said, for 16 years on the Isle of Wight, and I unfortunately lost my brother-in-law very suddenly, and my husband is also in the medical profession. He's a surgeon. We had a couple of young children at the time, and we were at that stage where both of us were working so hard, we weren't really paying enough attention to the family, and I think losing someone really close to us made us sit back and think, what are we going to do with our lives? And so I thought long and hard about what I could do to change it and to make myself feel really fulfilled and enjoy my medical background, yet still spend some time with the family. So I decided that the sensible thing to do was to transition into aesthetics. And I haven't looked back since. I've absolutely loved it. And I think having that medical knowledge background and that ability to sort of nail down what is the underlying issue with people and having those communication skills has really helped me have a successful clinic within the world of aesthetics. And it's a really enjoyable job, I have to say. Absolutely love it.
Great. Well, I'm glad you're enjoying it, and hopefully the transition is paying dividends for you as well. You mentioned your husband's a surgeon. What type of surgery does he perform?
Nothing to do with aesthetics, I'm afraid. It's colorectal side of things.
Okay.
So,
all right.
yeah.
Well, not necessarily going to be connecting up with that, no. But
leave that one
you
where
never
it
know
should
in the
be.
future in terms of whether, because Neogen's not just great for aesthetics; it's actually great for surgery post and pre-op as well.
Yeah.
So, but that's another story. I think that we'll cover. That. So, you're all about natural results, I believe.
Absolutely. Honestly, I'm very passionate about that. I think it's, I think natural beauty is something that everybody feels very comfortable with, of course, and that is definitely the way that the market is moving, which I'm thrilled to see, really. I'm very passionate about making people feel really confident in their skin. So it's not about vanity, it's about well-being and their feeling that they feel confident within themselves. And I think that is particularly important for women. Obviously it's for men and for women, but I think women, as they transition through all their different stages in life and they hit menopause, etc., they can really lose their sense of self-worth and their place in life. And I think that I can make some little tweaks for them and sort of build their self-confidence back up, make them feel very sort of connected with who they are again, and just make them sort of sit up straight and feel that they're a sort of a valid member of society again. And it's a great way to build people's confidence. And I'm all about those subtle tweaks to help women do that.
And that sounds great in terms of helping people feel better about themselves, building up their confidence. And I'm glad that Neogen is helping you achieve that within your clinic and making a difference to so many people. You referenced menopause in terms of how that is an experience for a lot of people. In terms of the use of Neogen, has that been helpful with regards to it influencing the condition of the skin for people with menopause?
It's been an incredible tool, I have to say. We have only had it for a short number of months, but it's given me great opportunity to have a real versatile piece of kit that can address all sorts of underlying skin concerns, and particularly for menopausal women. The architecture of the skin changes, with the estrogen deficiency, and we are constantly losing collagen throughout our lives, but it takes a massive hit at menopause. We lose 30% of our collagen over the first 5 years of menopause, and so women can physically feel very different. And I think having the Neogen device, it's a fabulous, non-invasive way. I mean, no needles. I keep telling everyone this is a device where we can achieve really fantastic results with this device that just is a general skin rejuvenator, and it tackles so many different issues in the one hit, which is why it's so popular with a lot of my clients. And I think almost everyone that walks through my door would like tighter, firmer, smoother, brighter skin, and Neogen can deliver all of those. So it's been a fantastic tool. I have to say, I'm enjoying it for myself. My staff are enjoying it. It's a fabulous procedure to perform, and it's really, really well tolerated. And I think there's been a lot of sort of press out there with celebrities that have been having Neogen, as well as the lovely Alice Hart-Davis, who had a very high energy treatment. And I've had a number of patients of mine show me those pictures of Alice and say, "Is this really what I'm going to look like?" And I think it's so important to educate people that Neogen can be a very gentle treatment, or we can increase the energies and really give someone a much more aggressive treatment. But we can achieve very similar outcomes through both ways of doing this. We can do several low energy treatments and it really achieve a great skin transformation.
Great.
So I love it.
Yeah, thank you. There's a lot of good things that you said about Neogen and how well it's working there, which is awesome to hear. Just picking up on your point about the treatment that Alice Hart-Davis had, I agree with you. That treatment was a very high energy treatment, and she did have a recovery period.
Sure.
What she said in the Times, also when she had that treatment, in terms of the skin analysis that was done before and after using Avisia,
Yes.
it reported that her skin was 9 years younger based on the skin analysis tool. So whilst she did have a high energy treatment, she did actually make some fundamental changes to the health, the age of her skin, which
Yes.
I would have, it's a choice. You have to be able to, go through that recovery, but there are definite benefits in the long run. And you're absolutely right that you don't have to have a high energy treatment.
No.
The likes of Shirley Ballas, the likes of Linda Lusardi, they have only had the low energy, no more than 0.8.
Yes.
And you can see how the tightening effect is happening, as well as the clarity of the skin. So you're absolutely right that this is a very tailorable piece of equipment, which you
Yes.
can tailor to what you want to achieve, and the client's attitude to recovery as well.
100%. Yeah. So it's about making those personalised treatment plans, isn't it? And really understanding what's tolerable for your patients, how much downtime that they can anticipate and fit into their busy lives. And I think it's so important that we're all communicating well and singing from the same hymn sheet, and that we can really make sure that we're doing the right treatment for that particular person. So yeah, I have so many positive feedbacks from my clients, and interestingly, most people want to go for a lower energy treatment. and have slightly less downtime. And I think it is one of those things that I'm a very conservative person really, and I will always err on that side of caution. Because if someone has a second treatment and they feel that we need to go a little bit higher, then that's something we can always do. But it's really well received.
No, I like your style. I like how you go with the right energy. Okay, I think it's important that with Neogen, you don't put more energy in than you actually need to, because you are trying to balance the results and the recovery.
Yeah.
So I think that's a really good way of doing things. Just to take you back a little bit then, if I can, Dr. Haley, to your launch of Neogen. So I've heard some pretty special things. And you're on the Isle of Wight as well, which is kind of unique. So could you share how the launch went and what became of that, please?
Oh, honestly, it's such a pivotal day for our clinic. We had the wonderful Susie Bourne from Energist. And we had 3 live demonstrations. So we had over 80 people attend our launch.
80 people.
80 people. And it was such a buzz, I have to say. We had so many people that it was very difficult to fit everyone into the treatment room at this particular time. And it was wonderful, really, because there was so much excitement, because people really wanted to get their heads around exactly what Neogen was, because we haven't got another device like that on the Isle of Wight. So it's a relatively new concept for a lot of my patients. And so they wanted to see firsthand exactly what it was like. They wanted to see how tolerable it was for our lovely models who were demonstrating this. And Susie really talked so well through what it felt like, what the downtime would be, what people can expect from this. And it was fantastic. So we had 41 bookings from that launch, which is an incredible number. And half of those were booking a course. So we really were, and it had an incredibly successful day. We had some other experts there on the day as well. We had Rebecca O'Brien from All Skin Med, who gave us her knowledge and expertise about the growth factor serums that we use alongside Neogen to improve the clinical outcomes. So she was fantastic. And we also had the very lovely Kirsty Jameson from Aura. And we were demonstrating our 3D skin analysis, which uses AI, which is another fantastic thing. So there was a real educational buzz. We were all absolutely exhausted at the end of that, but I think everyone came away full of enthusiasm for what we were offering. So the launch was such a success.
I think that might be the record. I think you've really set a high bench, especially for the Isle of Wight as well. So. I'm hearing more about the success of these launch events. And Energist does pride itself on doing everything possible to ensure that the clinic makes a quick ROI, return on investment on the device, because that's really important to us, because that will breed success for yourself and for others who want to offer such a versatile, tailorable treatment. So glad to hear that was a very big success. You've had it now in operation for a few months, 2 to 3 months.
Yeah, absolutely.
And how's it going?
Fantastically well. You can hear the noise of that machine going off most of the time in my clinic now. We have myself, our nurse, and one of our therapists that do the treatment. And so it really is ongoing. We currently, I think we've got 124 bookings. On
the cards, ready to do.
On the cards, yeah. So we are flying, absolutely flying. And it's every time I do a consultation for a new client, it's something that I can add into the mix there. So it's not only for our existing clients who want to, explore that regenerative and rejuvenating skin treatments. It's also for those new clients who maybe come in with different things such as acne scarring and active acne, as well as a lot of sun damage, which is something that we do get a lot of on the Isle of Wight.
All the sailing that takes place around there. Yeah,
we have a lot of sailors and a lot of farmers, and it really is something that can tackle a lot of their concerns: pigmentation, redness, sun damage, and give them also that general skin rejuvenation.
And how about around the eyes?
Yeah, isn't it a wonderful treatment for that? So, we've always slightly struggled, I think, in aesthetics to come up with a really good solution for around the eyes. So there are there are injectable procedures, but really something for most people that they can tolerate and give them that general skin tightening. It's just been wonderful, and we do treatments just around the eyes with the Neogen as well.
Only,
occasionally that's the only thing that people
I guess
want
it
to
could
go
fit
for.
if somebody hasn't quite got the money for a full face, then
Correct.
they can go for their target area.
Indeed, and it's very well tolerated, and it really does. We've got some fantastic before and afters, even after one session, that shows significant tightening around the eyelids. So
Where are you seeing that
wonderful.
tightening? Is it the
Around the crow's feet, but also the upper eyelid. We've got some
It's getting
fantastic
lifted, is it?
results. We're lifting that upper eyelid, so it's it really is a valid alternative to a surgical blepharoplasty. I think the outcomes are proof in themselves that we can really make a difference, unless someone has really got a huge amount of excessive skin, that they'd be more appropriate for
Sure.
a surgical intervention. But for most people who don't want to go under the knife, this is a fantastic alternative.
I would wholeheartedly echo that comment that it does offer a solution for most people in terms of the laxity around the eyelids, the crow's feet, the puffiness underneath the eyes, some discoloration under the eyes.
Yeah.
So with Neogen, we can treat right up to the lash line,
Yes.
both under and above the eyeball and up to the brow. So you can get a number of pulses in there, which is very comfortable compared to other devices which have to use light or laser. They have to use ocular shields to put in the eyes.
Yes.
But we're fortunate with Neogen that we don't have to use ocular shields because it's thermal energy. And having treated 500,000 people around the world over the last 10 years, we've not had a single adverse incident reported.
No.
So it's a very safe device. And
Yeah, it's fantastic.
we feel very, very privileged to be able to have this unique selling point about Neogen around the eyes.
Yes, yeah, it's a great piece of kit to have in my arsenal for eyes, definitely.
So, Dr. Haley, can you tell me a little bit more about your clinic on the Isle of Wight and why it stands out from other clinics, and why, what would your patients say about their experiences?
Yeah, for starters, it's just such a beautiful place. We have really invested in creating a wonderful, calming, elegant environment for people to come in. So as soon as you walk through the door, people always have a wow expression on their face. It's a very impactful and calming space that we have, and we have such a wonderful team. There's 7 of us who we're all very professional and welcoming and very friendly. So every single patient that comes to us, they are really treated like VIPs. We go out of our way to get to know them, to treat them extremely well, right from the get-go, first contact, right through to through treatment planning, through treatments and the aftercare and the follow-up. So we do invest a lot of time in our patients, and we certainly don't rush anything. And I think it's that sort of overall holistic care that we really try and deliver for our patients, and they feel very valued. And I think because we are medical based, as myself, and we have a wonderful aesthetic nurse, we have CQC registration, so people are always reassured that they are in a safe, a well-considered environment that is going to really have their well-being at the focus centre of everything that we do. And I always say to my patients, we all want the same outcome. We want them to feel fantastic and walk out of the clinic with an extra bounce in their step and really help their confidence bloom. That's one of our sort of prerequisites. We want everyone to walk out feeling fabulous.
Yeah, we think confidence is a really key word for the experience, the patient outcome, and what it does for people who have the treatment. So it's a really key word. It's one of the things that is part of our mission, really.
Yes.
So can I ask a little bit more around the consultation process? Do you do the consultations, or is it a mix of people do the consultations?
It's 99% me, actually. Yes.
Okay.
So yeah, I really enjoy that side of it. I think building up that doctor-patient relationship is so key, and I think that's where we create that sort of trusting relationship for the long term. I mean, most of my clients are regular. They come in and see me every few months, and so it's a long-term relationship that we're building. And I think that's so beautifully linking in with Neogen, because this is a long-term improvement, and I think that creates lovely, authentic, natural-looking results. This is not just correcting little signs of aging. It's about really improving that skin architecture and really getting to grips with the deep collagen formation that we all need as we're getting a little bit older.
Yeah, I totally agree. What I've seen is that trust that you achieve.
Yeah.
And the communication, managing the expectations.
Yes.
And also taking good before and afters. So
that's key.
Your new piece of kit with regards to taking analysis at the beginning and at the end will help when maybe there's that little percentage of people who don't necessarily see the results because they're looking in the mirror every day.
Yeah.
When you present back to them the beginning to where they are now,
yes,
it's very conclusive, and it really helps that conversation if you need to have it. But normally, with Neogen, the results are visible too, and people get asked, what have you done?
Yeah.
And I hear that so much about Neogen.
Absolutely, it's that overall improvement, isn't it? That you can't quite put your finger on almost, what they've had done, and it's such a natural looking result. It's a wonderful thing, but I totally agree. Photographs, I'm always snapping, always getting my camera out, and now the Aura.
And then the other, the contact with your customers.
Yes.
Do you talk to them like daily after their treatments in terms of how they're doing, or when do you follow up? What's your level of follow up with them?
Yeah. So usually we have sort of an open contact policy, so everyone gets a very extensive aftercare information sheet, both sort of physically and on email, and we quite often contact people directly. So we don't always encourage everyone to phone us every day. I don't think that's really manageable. Your response levels are
very high then.
Absolutely, when needed,
it.
Absolutely. And it depends really. If someone's had a higher level energy treatment, we'll be much more engaged with their follow-up. And some people we do ask to have a daily contact point with a little selfie being taken and sent to us. And if some other people maybe need a little bit more hand-holding if they're a little bit more anxious about things. So we, again, tailor it to the individual. Some people just can't fit that sort of follow-up in their lives. But we do get people back for a review, and certainly our focus is on that sort of 3-month review so that we can get some really good after photographs and proper skin analysis if we need to, so that we have that reassurance that we are achieving our goals. That's all important.
Sounds like a great process.
Thank you. Simon, I was interested to see how you feel Neogen is going to be developed within the industry.
Thank you. So we're doing very well at the moment in terms of our growth. The medical aesthetic industry has been quite challenging. I don't know whether you know, with all the kind of global turbulence that is going on. Consumers are spending less, which is driving a bit of uncertainty with regards to practitioners investing. But because we are so focused in terms of working with customers, especially in the UK, we're overcoming those confidence issues, and we are working very closely with them to ensure they achieve a success, like the story that we've just heard from you, in terms of just really putting everything into making sure that the demand is there in place. We're investing in PR, as you know, with Shirley Ballas and Linda Lusardi. We have a whole raft of other celebrities who are being treated right now.
Yes.
So we're doing that. We're doing this. We're doing lots of things to help drive treatment demand to the practices, which I'm hearing more and more. That's really setting Energist above other technologies, manufacturers, in terms of how we're helping the practitioners achieve their return on investment. So as a company, we're kind of differentiating ourselves by offering a lot of support from a marketing, from a clinical, from a customer service, etc.
Yeah.
From a technology perspective, Neogen stands out from a safety and from an efficacy perspective. From a safety perspective, it's using thermal energy, not light and laser. So you can actually tailor the treatment for those people with darker skin types as well.
Yes.
Which there is less chance of having issues with darker skin than there is with light and laser. So it's safer from that perspective. We also already talked about the eyes in terms of it's safe to treat directly to the eyelid. It's very tailorable. So I think we've already learned that you can tailor the treatment to the patient's needs, their attitude to downtime. We can decide how deep to resurface the skin to remove the pigmentation. We can turn up the energy to remodel the dermis even more to get more transformational results. So, and also I think the versatility of the platform, and what I mean by that is it really is for everybody.
Yes.
You can treat any age, you can treat any body part, you can treat any skin conditions apart from tattoos. And this means that it does allow the practitioner to really tap into a huge amount of aesthetic budget that is on the table out there. So,
Yeah.
and I would also say it's a great standalone device, as we just said, in
Yes.
terms of you don't need to combine, because you already get resurfacing, regeneration, and tightening from using a Neogen. It'll fix so many indications in one go. If you go in for an acne scar treatment, yes, it'll fix your acne scars, but it'll also close your pores, it'll remodel your scars, it'll reduce your pigmentation.
Yes.
It basically cleans up your issues and encourages that epidermal turnover and the function of the skin so that it really gives it a kickstart and takes it back to where it was a number of years ago. So it performs its natural processes more readily. So whilst it is a standalone device and it performs the functions of many modes and mechanism of actions that other energy devices do themselves, it is combinable.
Yeah.
So it can combine with
Yes.
lots of things.
Yeah, and that's what I'm finding now as well. Now we've got to grips with the Neogen itself. We are combining it with the polynucleotides to really help with that regenerative process and that sort of repair of skin, and gives a fantastic rejuvenating effect. So that's a lovely combination. And even with other injectables, we tend to have less injectable treatments if we're using Neogen, perhaps a little bit less toxin, a little bit less filler. And I think that's the way that most people want to progress now. We're very much looking for that sort of more natural, regenerative type of aesthetics over perhaps a longer period of time, and perhaps starting that regeneration and that rejuvenation a little bit earlier rather than be purely corrective. So it fits in beautifully, doesn't it? I mean, that's why I'm loving it so much. It's a wonderful tool to be able to sort of combine with those other treatments.
Yeah, absolutely.
Yeah,
so you mentioned you have a hydrofacial. Yeah.
We do. Yeah, I love it.
So one thing that's interesting about the efficacy of Neogen is that it works best when the skin is hydrated.
Absolutely. Yeah.
So if you were to perform a hydrofacial or another treatment which helps hydrate the skin prior to performing a Neogen treatment, then this is going to help the thermal energy that Neogen delivers cascade through the skin as deep as it can go. So, at lower energy, we're able to deliver temperatures, we will get temperatures that will modify the papillary dermis even at low energy.
Right.
Which is great in terms of achieving improvement in fine lines and wrinkles and pores, etc. When we move up to just over a joule, we're then starting to modify most of the papillary dermis. And if we go to high, we're modifying the reticular epidermis. So it's all kind of dependent on the energy levels that we fire
Yes.
and the hydration in the skin and also the condition of the skin.
Yeah.
Would you agree on that?
Absolutely, and I always encourage people to be well hydrated before they come in for their Neogen treatments, and certainly at a high level of energy, we often suggest that someone has a hydrofacial beforehand, as well as using some electrolytes as well. It's all about that sort of general hydration, and certainly downtime is improved and reduced if someone has got really beautifully hydrated skin anyway. So yeah, hydration is key. I think as part of this. So.
And then just jump into the after treatment. So polynucleotides, you mentioned you use those, or growth factors, which?
Yes, we use a beautiful SCA Pro from All Skin Med. It's a 40% growth factor serum. It absorbs so beautifully into the skin, and it's just the perfect opportunity, isn't it, immediately after a Neogen treatment, to really allow that to get beneath that epidermis into the dermis, and to really stimulate those fibroblasts that are sitting there and producing more collagen and more elastin. This is what we want to remodel the skin.
Do you find it helps the recovery as well?
Absolutely, yeah. We encourage people to purchase an additional amount of these growth factors so that they can continue that process at home for a month or so after treatment, and we're finding that gives better clinical results. So it's a win if you're going to invest in Neogen. I think combining with those additional very easy things to do at home, you can get an even better response and outcome. So, yeah, love it. It also feels great.
I think I've tried it.
Have you tried it?
I did. Yeah, I had a very big treatment actually in the US going back about a year ago, and I had some regenerative serum put on my face, and oh my God, I couldn't get enough of it. It was.
I know.
It felt beautiful, and just took away any heat, and it sped up my recovery as well.
100%. Yeah, it just feels so nourishing, doesn't it? And it's a beautiful feeling afterwards. Yeah.
Yeah. Have you had a treatment?
Yes, of course. Yes, I have. Yes, I've had both low energy treatments and mid energy treatments, and I've loved it. My downtime was very minimal. I had a little bit of redness in my face and neck and eyelids for just a couple of days afterwards, and a little bit of dryness and slight flaking in some areas of my face for 4 or 5 days. It was very, very, very tolerable, and I took videos of myself talking to one of my staff members, and on the video I'm saying I'm never going to show anyone this, and of course I'm showing everybody because I'm so it's such a wonderful thing for people to see what the genuine real life results are like, and I'm very proud of my skin, and it's certainly made a big difference to my skin quality.
I would agree with that.
Oh, bless you.
Complimented you earlier. Your skin is fantastic.
Thank you. Yeah. Well, it's a big part of that is down to Neogen, and I'm going to carry on. Absolutely.
Yeah, no, it's about just topping up from time to time.
Absolutely.
So glad you've tried it out, and you're going to have some more. So, and it's always good, isn't it, to be able to describe the treatment that you've experienced with your patients 100%, as well.
Yeah.
So big believer in that. So I'm looking to. I know you've only had the device for a few months.
Yes.
But can you see where it's going to go for you? Can you? I know you're rocking it right now.
Yeah, we are rocking it. Absolutely. Yeah. I see it as being pretty integral, to be honest with you, with the way most people want to progress with their aesthetic treatments. I think because I believe in it so wholeheartedly, and the results are so evident. I feel that actually it's a very worthwhile investment for most of my clients to use, because I think, as we indicated before, you're treating so many different skin issues, all with the one hit, and reducing your need for lots of the other treatments that maybe people are already having. So I think we are going to be using it as part of our treatment planning for almost everybody that walks through the door. And because it's an enjoyable treatment, it really is. It's people are relaxed. It feels a little bit warm. But honestly, the overriding feedback is, when can I book my next one? It's one of those wonderful treatments that people genuinely enjoy, and the results just keep coming in, which is wonderful.
Awesome. In terms of, you mentioned there's a lot of sailors and farmers on the Isle of Wight, yeah. So I can imagine they after spending so much time in the sun,
Yeah.
they've at least got some level of pigmentation from the
Yes.
sun in their skin, and for some there may be the start of precancerous lesions.
Yes.
Now, Neogen is cleared for the treatment of actinic keratosis and seborrheic keratosis, precancerous lesions. So have you, I know it's early days, but have you started to see how Neogen can clear AKs and SKs?
Yes. Yes. I mean, these are common skin complaints, particularly for us on the south coast there. Yeah, absolutely. If we are careful with what we treat, obviously, if there's any suspicion at all, we will refer on to our dermatology colleagues. But otherwise, we are in a very safe territory. And as you said, it is an FDA-approved device for the treatment of those changes, or the actinic keratoses, which, they are very, very common. And I've seen the results, and my lovely husband has been under the Neogen device. So he has been.
Where did he get treated?
So he's had nearly a full treatment over his forehead and around his nose area. He's got a lot of sun damage there, and he is noticeably smoother. Those little actinic changes, which he's had previously treated through more traditional methods that have returned, have been really successfully treated with the Neogen. So another walking advert.
Yep, I am too. So for me, not having any hair, that's obvious. I've had my scalp treated a number of times.
Yes, yeah.
And actually, like you say, smooth. Feels so smooth after, and it has cleared up a lot of the pigmentation. And I did have an AK here.
Yeah.
And after just one treatment, five shots, basically it's gone. Yeah. So it really is. It's a sweet spot is aesthetics. However, around the world, we're seeing it being used for dermatology.
Yes.
And we're seeing it being used for to support surgery. Which can I take a minute just to talk about that, if that's okay?
Of course.
So when I talk about the uses in dermatology, we are talking about AKs and SKs. We've got many practitioners around the world who are using it for rosacea, for atopic dermatitis, eczema, acne, wound healing, which is a new thing in terms of stimulating regenerative growth on fragile skin, or broken skin, or necrotic skin. So we're seeing more and more of this around the world.
It's really exciting.
It's some of that is off-label. However, we will be working with our practitioners to increase the level of official clinical evidence that we have supporting these things. But there are many successes happening out there, which is great. So I'd love to see it expand into the area of dermatology. And then in terms of surgery, so surgeons could prep the skin by using Neogen to make it thicker, because we know that Neogen is thickening the skin. We've just had a study conducted by an independent skin company called Q-Test, and that 10 patients over 3 treatments has demonstrated an 84% increase in the skin density. And it's also, another highlight is a 54% reduction in cheek wrinkles. So these are, really significant changes off low to some mid energy treatments.
You guys are doing so well. This is amazing, isn't it?
It is. We are, and thank you.
Right across the board.
We are still kind of exploring the full capability of our technology, but we've got wonderful practitioners around the world, like your good self, who are helping us get the word out there and helping us achieve great clinical evidence.
Wow, I'm so pleased to be part of it, to be honest, Simon. I think it's certainly going to be a big part of the future, isn't it? I think it's great.
That's the goal. We want Neogen to be available for everybody, and we would like to see it used in hospitals, in private, all across the world, so that people can get the medical benefits as well as the aesthetic benefits of the technology. Absolutely. That's important to me. So before we wrap up, I've got we're going to try to do a bit of fun.
Okay.
So I've got 10 10 questions here, quick fire, okay?
Okay, I'm ready.
All right. So the idea here is I say two things.
Okay.
And you've got to choose your favorite. No explanations, just instinct, okay?
Okay, gut instinct, right.
So this is new for me as well. Ready?
I'm ready.
Injectables or skin rejuvenation?
Or skin rejuvenation.
Morning consultations or evening treatments?
100% morning consultations.
Natural glow or smooth complexion?
Okay, I'm all about the natural glow.
Seeing patients or reconnecting with long-term clients?
Oh, God. Okay, that's hard. Long-term clients, love the relationship. Yeah.
Okay. Holistic wellness or advanced skincare?
I'm going to go for advanced skincare. I love a bit of skincare.
Island life or city hustle?
Island life for me.
Obvious one, that one, yeah. Industry conferences or private training sessions?
Oh, I'm a private training session girl. I love that.
Yeah,
Bit of
me
one.
too.
Yeah.
Subtle changes or full transformations?
Well, I'll give the subtle.
Yeah, I think that's consistent with what you said earlier. Coffee-filled workdays or wine-filled evenings?
Okay, well, I'll go for the wine-filled evenings, of course.
I'd be surprised if you didn't. The last one, innovative devices or personalized treatment plans?
Oh, God, you got me there again, haven't you? So I'm going to go, I'm all about Neogen at the minute. So innovative devices like Neogen. Yeah, perfect.
Great. Well, some of those were quite tough, weren't they, in terms of they were close to the mark. But well done. That was
Thank
very
you.
personal to you, and you did great in terms of answering those. Thank you very much.
Thanks, Simon. Enjoyed it. Thank you
Good.
for having me.
So I just want to say a huge thank you from myself and everybody at Energist for being part of the Neogen family and part of the Neogen journey, and for today and sharing your experiences.
My pleasure.
Sounds like you are absolutely rocking it, and I'm sure you're going to take it
I
to
am
the
genuinely
next level.
loving it, I have
Yeah.
to say. Yeah.
Great.
Thanks,
Well,
Simon.
thank you so much. Thanks, Dr. Haley.
See you again. Thank you.
I hope you enjoyed that Neogen podcast with Dr. Haley Elsmore. We have lots of information available for you. So if you're a practitioner, you can go to our website, which is www.neogenplasma.co.uk, and you can learn about our technology and how we support customers in the UK and across the globe. And if you're a consumer, a patient looking for a treatment, well, in the UK, we have the same website, which has all of our clinics who offer Neogen treatments available to look at. So you can go on there and you can find the one that's closest to you and give them a call and work out a consultation. And that's the same website, www.neogenplasma.co.uk. Thank you for listening and wishing you a good day. Thank you. Bye.